Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to another lovely session this evening. I hope you've all had a good week, and we're so happy that you're joining us again. This is the Early Intervention Matters podcast. It's a platform that discusses neurodevelopmental disorders, brings in guests. We talk about different aspects of neurodiversity that impacts on families, parents, teens, young people, professionals, and members of the public. So the aim is to build awareness of conditions and know how to support young people better, and just see the positives and how we can see neurodiversity in a normalized manner, and try to see how best we can support people with this difference. I'm really excited tonight because I've got an amazing guest with me. I've got Janine with me. Welcome, Janine, and thank you for joining us tonight.
Be here. I'm so excited. So, what can I tell you? I have quite the history with ADHD and neurodiversity, and I love to talk about all things neurodiversity. And I also have 30 plus years of education, special education under my belt, some administration in there, some teaching. Oh, all kinds of stuff. When I was 50, I was diagnosed with ADHD myself, which was quite the surprise considering that I had been a teacher of students with ADHD. I never recognized it in myself, but I guess we look very closely at other people and not so closely at ourselves sometimes. But after I retired from education, I jumped right on into ADHD life coaching. That just seemed like the next move for me. And I was excited to start working with people one on one again. So I really started to focus in on being able to touch lives individually and hopefully make people's lives a little easier to handle with their ADHD.
Thank you, Janine. I was a guest on Janine's podcast. I think it was last month, and we had such an exciting conversation. We could have gone on and on and on. And I think I was particularly excited because Janine worked in education, and as we know, education is one of the places our young people really struggle most times. And it was just such an interesting conversation, and I was really pleased to see how much insight Janine had in, and we talked about, the environment, the support. So I just felt that this is such a key topic that we need to bring Janine on to talk about, because we still feel that there's a lot to learn about how to support young people with ADHD within schools, identifying them, supporting them, and actually helping their day to day. So we're going to talk about ADHD in education, and we're also going to talk about coaching and the benefits of coaching for ADHD, and why this is such an important aspect of the management, which we feel has not been given the right, amount of emphasis that should be during treatment. So we look forward to a very informative session today with Janine. So we're going to start first with ADHD in education. I know Janine is in the United States, and over here in the United Kingdom. But I remember that when I was on the podcast as a guest on Janine's podcast, there were similarities in the challenges between here and the UK. I think they were quite very similar things that we struggled with. Over here, we still have an under recognition of children with ADHD in school. So I just want to find out from Janine what, from her perspective, when she thinks back on her years as an educator, what would you say were the challenges in terms of identification? First of all, within the staff at school, do you think that people were knowledgeable in being able to identify young people and children with ADHD?
I think so. First of all, you got to remember when I first started education, I remember sitting in a classroom and having somebody tell me that ADHD is a disorder that is for little boys and little girls don't have it. So when I started my educational career, that's where we were at with ADHD. It was a little boy's disorder, and we've learned a lot since then. What really I think has been a big problem with education and ADHD is it's a good thing and a bad thing is that push and pull between the physical and the educational aspects of ADHD. So when a doctor diagnoses or identifies a student with ADHD, then it's our job to take over and try to educate them. And we talked about this last time. I would get so frustrated because I don't feel like the teachers and the doctors walk hand in hand at this point. And so teachers, yes, they have a difficult time identifying ADHD sometimes. On the other hand, they're not supposed to diagnose it. That's a doctor's job, right? And so we would often have to tell parents, we are not here to diagnose ADHD because it's a medical condition, but we are here to help him or her when they have that diagnosis, be successful in school. But we do want our teachers to be looking for, things in the classroom that might cue them. But I think for a long time, the things that cued them were if a kid was jumping up and down out of their seat, talking too much, getting in trouble, those types of things were what ADHD meant to teachers. And I still don't think, and I don't know if it's the same there, but I don't think we've gone completely past that yet. We're moving past it. We're starting to recognize other things about ADHD, but I still think that in the classroom, because of lack of really good training, teachers aren't sure that they're looking at ADHD when they're looking at it.
Yeah, I think you're absolutely right. I think even when there is a pattern where you sometimes see this pattern where a child is being excluded from school for the same types of behaviors, but you would almost expect that there would be some ways in which people will sit back and think there is a pattern here. What behaviors is this child or young person exhibiting that should flag up that this might be neurodiverse? So you might actually see children being punished a lot, being sent home from school, and they have the symptoms, but it's not been flagged up at
Right.
all.
And then bad behavior. Well, ADHD can look like bad behavior, but we got to remember that behavior is communication all the time.
Yeah.
Right? And they're communicating their needs to us without us really being able to recognize them all the time. Um, I do think that teachers are very quick to say this kiddo needs some help. I don't know what exactly is going on, but there is something going on. And then jump right on into I want to get him services, want to get him help and those types of things. And then I don't know how labeling or identification of special education needs work in the UK, but where we are, we have learning disabilities and we have otherwise health impaired, and there's 11 more of them. But both of those kind of can fall into the ADHD category. Unfortunately, as educators, we can't actually say the child has ADHD, but we can say they have a learning disability. And that's where it comes into play for us.
So do you group the ADHD and the learning disability in the state?
So generally, it's otherwise health impaired, but as you and I both know, with ADHD, oftentimes comes a learning impairment.
Mm.
So if you have a kiddo who's coming across with, exhibiting ADHD behaviors, but is also struggling and having a really hard time in reading, and we don't have a diagnosis from a doctor, we can't use otherwise health impaired, but we can give them the disability of the learning disability in order to provide
So they
service.
can get help. Yeah. Okay.
Because I try to get services for them any way you can.
So typically in the States, how do children go forward for an assessment. So in the UK, for example, um, I mean, it differs in different places. So in many places, because of our National Health Service, most people try to make things quite uniform. So it is expected that the parents will approach the school to write a report of the behaviors that the child exhibits and things that make them suspect the child may have ADHD. The parent then takes that report from the school to the GP to do a referral to get an ADHD assessment either by the pediatricians or the psychiatrist. If there is no school report, or if the school does not highlight the behaviors, the referrals are not accepted for ADHD. So even when the parents have said, my child has this, that, or the schools are saying, we're not really saying this, that behavior, then usually if that referral is sent, most times it might be rejected because the child is not showing those behaviors at school. So the child doesn't even get a chance to get assessed.
That's I'm sorry, but that's upsetting, isn't it? I'm like, that's upsetting a little bit. It's very interesting that it would start in the school. Generally, the way it happens in the US is if a kiddo starts to have trouble in class or whatever, the teacher may approach the parent and say, have you talked to your physician about these behaviors? And as a teacher, we were not even supposed to bring up ADHD as a possibility. That was like, you go see your physician and see if they have any ideas about the behaviors. And then the diagnosis or the identification would come from the physician back to us. A lot of times parents would come to us with a physician's information to say they need special education services, but the only part that the teachers and the educators have in the actual diagnosis of ADHD in the physical sense is we would fill out a survey. So the doctor, if a parent came to them and said, the teacher says he's having some behavior problems in school, this is what I'm seeing, this is what she's seeing, then the doctor's going to ask all kinds of questions about what's happening at home, what's happening at school, and what's happening in the community. Which is why, like you're saying, if they're not having a problem in school, it's just kind of thrown out. And we look at homeschool and community, and that's where they go from with that diagnosis, and then they go through the whole neurological testing process with the kiddo and start medicating or whatever. Does that make sense?
Yes, it does. It does. Yes, it's done differently here. But again, I think one of the similarities is if the child is not showing the behaviors or the teacher doesn't mark the child having the behaviors, then that child may not be given the diagnosis.
Yeah, and but it's only a portion of what, because I don't know, you must do parent surveys, how they act in the community, how they
Yes,
do
we
at
do.
home.
We do.
So for me, I feel like when you get to the point where there's not a problem with school, they're saying, well, there's not a problem with functioning, right? And so then even if there is a ADHD, maybe we don't really need to worry about if it's not affecting school, where and I can see that is oftentimes a stipulation, like, well, yeah, they may have ADHD, but they're doing fine in school, so they're doing fine, right?
Which which now I knew, which girl I know is not the case because
Exactly, exactly. And I've known a lot of kiddos where, they have and all they need are accommodations, right? Just a few accommodations through a 50 what we call a 504 plan. And I've seen other kids with ADHD that need full-blown resource room time, all kinds of stuff for their supports. And it so those kids that barely need anything, they may not qualify, right? I mean, if you need extended time, maybe they wouldn't get the ADHD diagnosis.
I completely agree. I think the assessment pattern has been quite rigid in such that a lot of children have not been given a diagnosis. And we see this where children have been assessed previously, not given a diagnosis. And along the line, that child continues to show the impairment. They get assessed at another time when things are more severe. The child is now more impacted. And then suddenly everybody says, ooh. And then that same child where nothing was said to be a problem initially, about having a lot of problems, and then definitely meets criteria. So you then wonder, how robust is this assessment process that is being done? Because a lot of children, in the school setting, and I see this a lot of the times, the question is come back from school, the school said no consent, no consent, no consent, no consent.
Well, and I'm going to be honest with you, that is exactly what my school would have said about me. They would have said they had no concerns about me because as a little girl, I learned how to mask. I learned how to, look attentive and do all of the things. I was very intelligent. So they wouldn't have seen it and they'd have been like, she's doing fine. But I have ADHD.
And I think that's one key thing, that's one thing that, it's important for people to understand, that that child or that young person that you're seeing there who is showing behaviors in other settings and seems fine in school.
But I was showing behaviors. I was very emotional, right? And let's talk about that because we've talked about the difference between some of our definitions and some of them including the emotional portion and some not including the emotional portion. But I was very emotional and I talked a lot and I did a lot of the things that we look at characteristically as little girls with ADHD now. But back then, they would have looked at me and said I was just fine. But I don't know. Would you say that the US and the UK are about the same as far as advancements, acceptance, and all that stuff? Or do you think that the US is ahead of the UK? Um, I'm just curious because, like, I've heard that the UK is probably like 10 years delayed from the US when it comes to attitudes about 80.
I would say that there's increasing awareness now. I think the discourse has changed definitely from when I started. I've been a pediatrician in my job now for over 20 years, seeing children with ADHD and doing assessment. In times past, the resistance for parents to think about it was higher because of a lot of stigmatization, because parents felt that they would be looked at negatively by the society, by people, when they thought their child had ADHD. And actually, some children, when they came to the clinic, because of their perception that the naughty kids had ADHD, if they ended up having a diagnosis of ADHD, I've seen children have full-blown meltdowns and cry. And when I've asked them the questions why, and it's been like, no, I'm not naughty like that child. That other child is so naughty. I can't have the same thing that naughty child has. So there was a lot of negative connotation. The media wasn't helping as well. We had there's some newspapers that frequently would say, oh, many kids are getting diagnosed, overdiagnosed, and parents are giving their children pills to keep still and all that for badly behaved children. So even families where the children had ADHD were very hesitant to actually confront that assessment and diagnosis because they were worried about the stigma and all that. So over time, the discourse has changed. I think people are more receptive and more aware. People recognize symptoms more, and we have seen that even in the rate of referrals and people recognizing again that adults. So we are picking up the fact that parents are identifying themselves as having symptoms and going forward for assessment. So what I can say, there's been a shift in people being open for that discussion and people no longer being, very shy of it, but there's still a way to go. There's still children who are not being identified. There's still cultural differences and, people in different cultures not wanting to approach the topic, which is one of the things I cover in the podcast. I deal with that because you see some cultures where, people are
Caribbean. The Caribbean is one of those places.
Oh yes, the black and minority, the African.
I have
I
on a
know.
podcast with a Caribbean lady, and she was talking about how, yeah, their attitudes are a lot different.
Yeah, yeah, they won't accept it. There's a lot of, oh, no, 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 it can't be, because the society views them differently. So we do find quite a lot of neurodiverse children with ADHD in that population who've not come out for assessments because, because of all those barriers and myths. So there's still a lot of challenges. Yeah, so this is one of the problems we've got where a lot is hinged upon schools providing information. But one of the challenges is also the fact that some teachers may not really know the child that well. There's still this problem with the schools having to heavily rely on supporting, providing that information, and the class sizes we talked about.
Class sizes, that's what it was. So our class sizes at the elementary level tend to be around, well, it depends on where you're at, because if you're in a small rural district, you can have classes like 20, 25 kids. Get into our more urban areas and we're talking 30, 35. So yeah, it can get pretty hectic and hard to keep track, especially when you have students with special needs in with your general ed population. You're trying to meet all of the needs of every student, differentiate all of your instruction. There's all these things that are going on. So you're absolutely right. Sometimes the teacher doesn't know them well enough.
Yeah.
And I don't know about you, but I have found that parents come into the school year saying, I think my kiddo has ADHD. I think they need help. That's the time when the teachers are just getting to know the kids.
Yeah, that's true. Yeah, so if a teacher who hasn't worked with a child for a while is asked to complete or talk about the child, it's difficult. One of the things I've found useful, sometimes when I send questionnaires out and I'm thinking this response just doesn't really match what I'm seeing in the child, I do ask for a one-to-one chat with the teacher, and I do, the parents' permission, say, can I speak to your son's teacher and all that? Because I find that in conversations sometimes, allowing the teacher to talk about the child and just talk about things about the child helps me to get a better picture of the child rather than just looking at scores on tick boxes. And I've
Yeah.
found that quite useful.
Well, and the thing with the surveys is I really think that depending on whether the kiddos had a good day or a bad day, when the teacher fills out the survey could be different.
Yeah,
So this week you could fill out the survey this way, the next week you're going to fill it out the next way, depending on where the kid is and their behaviors. So I feel like it's a moving target almost.
yeah, absolutely. Absolutely. And the fact that you could have two or three people in that class filling the same questionnaire and presenting different aspects of the child,
Yeah.
I think it just highlights the fact that we need to be more robust about collecting information. And that one of the things I have learned is just because you get a negative questionnaire that says no problems when the child and the parents are saying there, it doesn't mean that there isn't any problem. I think it's for exploring more. And I think one of the things you brought about is, not just home, but the community, the communities where the child also is and spends time. So just finding out from other people, finding out about if the child goes to clubs, we do send information to clubs to explore how the child behaves there. Small play groups and things, just trying to find a church, exactly, finding out. And that's one place people hardly explore.
Yeah, but I bet you could really identify a lot of characteristics of an ADHD kiddo in church.
Yeah, yeah, you can see that. You can see that, and I think which is interesting because I think when people are exploring things, people say, "Oh no, give it to your school teacher, your class teacher," but people hardly say, let's find out how the child is at the worship place or the church, or which is interesting because that child is going to be spending a couple of hours in that setting. How is that child with other children in that setting? And I think we need to be thinking about exploring these other settings quite regularly when we're exploring ADHD. Great. So for the children who've had a diagnosis, what support?
So in the US, we have, I don't know how in depth you want me to get, but we have two laws. We have the ADA, which is the Americans with Disabilities Act, and then we have the IDEA, which is the Individuals with Disabilities Education Act. And so there are two laws that help protect people with neurodiversity or disabilities in general. The ADA is a 504 plan, and I brought that up earlier. And so a kiddo with ADHD may just have a 504 plan where they have a plan that's set up that they get certain accommodations to help them in the classroom and be successful throughout the day at school. But if their ADHD is severe enough where they actually need instruction on executive function, or, they have difficulty with reading, math, which is really common. So with their academic skills, they may end up with special education services through the IDEA, which is a document that goes K-12 for a kiddo. So the support documents, the legal supports are bound up in those two laws. Uh, as far as the actual services go, it can be anything from providing extra time, special seating, frequent breaks, all of those types of things, all the way up to direct instruction on, building and maintaining relationships, so, and everything in between. Um, I hope that answers your question.
Yes, it does. It does. And I think your IDEA is quite similar to what we call our educational and healthcare plan,
Yes.
which is a statutory document that goes with the child through the year. So just moving on, let's talk about your diagnosis. You said you got diagnosed at 50.
I did.
Yeah. What led you to explore the diagnosis at that time?
Well, so it was I'm sure you've seen this a million times. It was the domino effect. My son got diagnosed with ADHD. I had suspected my daughter had ADHD her whole high school or her whole educational career. Let's be honest, like when she was 4, I thought she had ADHD. And several times we went through that process of she's doing fine in school. She's, there's no problems, blah, blah, blah. But I was seeing it all at home. And so I felt very disregarded when it came to my daughter and her diagnosis. She was not diagnosed until she was 24 and then properly medicated. And, her whole life changed to a large degree. But so there was that one, and then my son. And so then my psychiatrist said to me one day, have you ever considered that you might have ADHD? And I said, well, no. I mean, I've worked with people my whole life with ADHD. I would recognize it, of course, if I had it. And she's like, well, just humor me a little bit here. Let's try some things. And so she put me on medication, and we started really diving into some things, and sure enough, yeah, I had ADHD. And so I found that out after I had been central office administrator in a large school district for a few years, and I was like, no wonder I am working so much harder than everybody else. And this all seems so much harder for me. So it was quite an epiphany for me. And from there it went to I started doing research and really diving into adult ADHD and what that looks like. And I looked at my husband one day and I said, honey, if anybody has ADHD in this family, it's you. And so I'm like, because you are textbook. And so sure enough, he went in, got assessed, and also was diagnosed with ADHD. So our whole family, including my 79-year-old mother at the time, have been diagnosed with ADHD.
Wow. So how did that make you feel after getting the diagnosis?
It was a combination of things. On the one hand, it was a huge relief because suddenly a lot of things in my life made sense, and things that I had been beating myself up for suddenly came to light that maybe this was because of my brain, not because of my personality. And I just thought I had a difficult personality to some degree. What really struck me is when I said to people, I've been diagnosed with ADHD, and they said, well, of course. And I felt angry. I felt
Those people,
it's like if you knew why didn't you tell me? Why didn't anybody tell me I had ADHD? Because nobody's surprised that I do.
Mm,
So there was anger. There was anger, frustration, and then again relief because of,
mm.
knowing that it wasn't really a personality flaw.
Wow. That's interesting. So a lot of people will spot it and never mention anything. Yeah.
Yeah, they were like, "Yeah, well, of course you do." And I was like, "Well, that would have been helpful for me to know."
Wow.
But since I found out, a lot of things have fallen into place for me. I really focused in on ADHD. And as much as I knew before, and I knew a lot, I used to train on ADHD. I used to work with teachers on helping them identify, strategies for kids. I'd done all of these things with ADHD. I realized, well, this would be great to do with adults for myself. And so when I went through my training as a coach, I was coached. And I learned
Yeah.
so much about myself. And so the diagnosis in combination with actually learning what that diagnosis means, learning what ADHD really is, how it affects you, all of those things can make you such a stronger person in the end.
Mm. Fantastic. Wow. And then you went into your journey with coaching.
Yes. Yes. So then I went
What?
into my coaching journey, which I decided, yeah, I wanted to get back to working with people one on one. And so I took a class on ADHD coaching, got trained, got certified. So I'm a certified ADHD life coach. And in the United States, and I don't know how it works in the UK, but anybody can be an AD or it can be a life coach. You don't have to have special certification, which is very frustrating to me because there are some of us out there that are highly trained, and it's
Mm,
like, you really need to look for some highly trained folks.
mm,
But I really have enjoyed the process of it's not I use a butterfly as my logo, part of my logo, and it's because of the transformative value of coaching. Because really, when you start out, you're kind of in that cocoon. And by the time you get out by the end of your sessions, hopefully you've bloomed out of that cocoon. My goal with coaching is to teach you how to coach yourself. I don't want a lifelong client. I know that sounds crazy,
mm.
but I want to teach people how to help themselves, how to see the barriers, identify their barriers, figure out how to get over, around, or through them, um, and come up with their own strategies. So through coaching, I'm able to ask questions and get them thinking about processes in a different way. And by the time we get done, they've learned a skill of how to work with themselves to get through the next step.
That's amazing. And so for our audience, could you talk a bit about what coaching involves? So what do you do during typical coaching when people come to you for coaching?
So coaching on the surface looks really simple. It looks like really plain because what it is me asking a lot of questions and the person answering them. And essentially, they come to the coaching situation with a problem that they want to work on that day. It's all client driven. It's up to them what they want to work on.
Okay.
But generally, I've had people come to me and do 45-minute sessions on I need to make sure that this $250 that I have makes it to the place it's supposed to get rather than me spending it on something else. How do I make sure that that happens? Because they had, spending problems and finance problems. And I've had everything up to a gentleman who had spent his whole life writing beautiful spreadsheets for his neurotypical peers and all this stuff for organization, and none of it worked for him. He needed paper pencil. So, but through working through the coaching, they would come and they'd say, okay, I need help with organizing my paperwork. And so we talk it through, find out what the situation is, what's worked in the past, what hasn't worked in the past, why it hasn't worked in the past. And then a lot of times we start to get into why we're emotionally attached to making sure that we're doing this paperwork in exactly this way anyway. Because a
Mm,
lot of times we find out that we're being held up by not the task itself, but by our head.
yeah.
The itty bitty shitty committee is what we like to call. And so with coaching, we work through it, we talk, we ask questions, we give answers. And at the end of the session, we have a plan, some sort of a strategy to try for the following week or whatever, how long. And then I like to have my clients collect data on their strategies to see how they're working. And then we just continue to do that process. And as we do that process, about session, I'd say 7 or 8, my client will say, I know what you're going to ask me. And that's when I go, yes,
Mm,
you're asking
mm,
yourself the questions. And
mm,
I literally just got goosebumps because it's like one of the most exciting moments when a client's like, yeah, I know what you're going to ask me.
mm.
And so, yeah, I don't know if that answers your question, but I
Yes,
get
it
so
does.
excited when I talk about it.
I know. And so, so you tend to work with them about you said the client brings the problem that they want to work through. And so with ADHD, organization is one of it, and um, planning and all that. So uh, typically, how long does a session work?
I usually with my clients, I work with them for 10 sessions that are 45 minutes long, for 10 weeks. And then after that, I will have clients come back for like refreshers and stuff like that, a session at a time. But essentially, usually it's 10 weeks. And
Mm,
most people are feeling pretty good about going out and trying it themselves. Every once in a while, I have somebody will contact me and say, hey, I think I need a little bit of a refresher here.
mm.
We'll meet again, and then they go on their merry way. But if I can get somebody independently problem solving for themselves, that's my goal.
Yeah. Because I think that's a lot of things that people with ADHD struggle with. They get really overwhelmed. When I've seen young people, they just get overwhelmed with so many things, and then they procrastinate and then just can't face it, and it's not getting worse. And then that has a knock-on effect on how they feel emotionally, and you know causes a lot of mood problems with them. So we can see how untangling those things just helps them.
Absolutely. Sometimes, like, have you ever I'm sure you've had a conversation with somebody and they've said something and you've like, I've never thought about it that way.
Mhm.
Right. And that's a lot of what coaching is about, the aha moment. Like,
Yeah.
I've never thought of that. But the ideas come from within you. There may be some suggestions or whatever, but for the most part, it's all about the client coming up with what's going to work for them, because like what works for me is not going to work for you necessarily, and vice versa. But if we come up with our own solutions, we're much more likely to get something that works.
Mm.
And it's my job to pull those solutions out. And then in the process of doing all of that, we also kind of get into some values work and some, strengths work. What are your strengths? How do you use your strengths to address the obstacles that you encounter? What are your values? Because I don't know, most people don't realize that our values are what drive us do the things we do and say the things that we say. But a lot of people have no idea what their values are. And so with my ADHD folks, I really try to make sure that we explore what are your values. And because when you get in a situation that doesn't work well with a value that you have discord. And when you have discord, that's when the problems start. But if you can't figure out why you have the problem because you don't know what your values are, you're not going to be able to address the problem. So I do a lot of values work as well. So yeah, I love doing it. It's amazing, and I I think coaching is a benefit to anybody. Doesn't matter if you have ADHD or not.
Yeah,
Coaching
definitely.
is a benefit to anybody.
Right. Definitely. And I'm sure a lot of my audience listening in will find this very beneficial, because I think one of the things that I struggle with is, as a clinician in the hospital, you're limited by what you can give to your patient and your parent, because, they come in, that they need to have support with all the other things. They've got this, yes, you're giving them the pills, but they're still struggling with getting themselves organized. They're still struggling with being able to turn in that work on time. They're struggling with all the things that just drives them up the walls. And the pills don't go near those things. So it is something that I do feel that almost every other person that's got a diagnosis of ADHD really can benefit from a coach to work with them with all those other things. And it's one of the things that if people can invest in getting a coach to walk that journey with them, they would find it really helpful. But like you said, it's about getting the right one.
Oh, yeah, absolutely.
Yeah.
You know, every coach is not going to work for every person. I'm a very boisterous, very out there, very, animated kind of a person. Some people are kind of put off by that. So,
Mm.
I would suggest to them, that they go look for somebody else who's going to be better off. I would never want to work with a client who doesn't feel like we're a good match on my part or their part.
Yeah.
If I'm feeling like that we're not a good match, I'm gonna say, maybe a different person might be a better fit for you.
Mm.
Um, because you really do have to be able to build that trusting relationship with those
Yeah.
people. So yeah.
So what would you say makes a successful management for ADHD from your point of view, having been someone who has been educator, you've seen children with ADHD. So let's talk about schools first. What would you say is what would be the approach, first of all?
Well, if I lived in a perfect world, the things that I would want would be much better training for teachers about ADHD. I still don't think teachers have a full understanding, especially gen ed teachers don't have a full understanding what ADHD looks like. So I would start with wanting to have our staff and people working with our students fully trained and understanding what they're looking for. The next thing I would want, and I think would be the most helpful or be very helpful, is let's stop hiding this from our kids. And I'm just going to say it flat out. You not telling your kid that they have ADHD is not helping them. And explaining ADHD and explaining what's going on with your brain and the training that goes with the teachers, we need to be training the kids as well. We need to
Yeah.
teach them what ADHD is and where strengths are and where their weaknesses are and how to work with those things. So I think for me, it starts with education about it. Then it's really looking at the kid and saying, what are their strengths? What are their weaknesses? How do we even that playing field? What does that kiddo need to be brought up to be able to be successful in school? And it's not going to be the same for every kid. So please, 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 teachers out there, if you are listening to me, stop just filling in the same accommodations for every kid. Every kid does not need the same accommodations. One kid may need extended time. The other kid may need frequent breaks and not extended time. So really looking at each individual kid and not trying to generalize, overgeneralize, which is, we're overworked. We're tired. And as teachers, it's hard to make sure that we're doing those things, but that's what the individualized part of that is. So those are my big, big spots is really looking at the individual, educating the kid and educating the teachers would be a great place to start.
I fully agree with you because I think you touched on something really important, which is every child is different. And I've seen this where you say, okay, child is going to have extra time, but the child says, no, I don't want extra time because I don't want the extra time. I think for that child is the movement breaks might just be better for the child rather than the extra time. So and it's an individualized thing. It's about knowing the child, knowing the strengths, like you said. It's really important. Parents, one of the things that usually helps with my discussion with parents is when I've gone through the diagnosis, I try to explain the brain. It takes people's focus from just looking at that child's behavior to then understanding why that behavior happens and that a lot of these things is just not within the child's control. And you see a shift in the parent perception and understanding from where they had been blaming the child to now being able to support the child. Just something as simple as that. Getting them to understand how the brain works differently just
Well, and
changes mindset.
that whole idea of like blaming the kid for their behaviors. I don't think I've ever met a kid that didn't want to do well, right? I've never met a kid who has gone to school and said, I'm going to be a hot stir fry mess today. I love being a hot stir fry mess. I'm going to get in fights. I'm going to do all these things. No kid goes to school wanting to get in trouble. So why on God's green earth do we blame them for behaviors that we know they don't want to exhibit? I mean, no kid wants to go to school and get in trouble,
Yeah.
but yet they say that it's the kid's fault. Do you really think that this kid got up this morning and said, I want to go to school and get in trouble? No.
Yeah. It's really something that people need to think about. And, I think it just makes us take a step back and think, like you said, no child wants to leave the house and say, today I want to go to school just to be a troublemaker, and do things so that I can get excluded. Children do not want to do that. And I think sometimes one of the other things that I have noticed is sometimes low level behaviors which children get punished for. A lot of the things is related to their ADHD system.
Oh, girl, you can get me started on a whole new thing here. It's like, like punishing this kid for having ADHD. That's what you're doing.
That's what I say. I said he got a detention for, talking. He got a detention for leaving his seat. He got a detention for just shouting at an answer. And then the child is, I find this quite difficult. So the child is then kept back at break time. And I say this just counterproductive for a child with ADHD who needs the movement, who needs to move around. And
I
you're
always
keeping
said
them.
to the teachers, you take away their recess, you get what you deserve because it's going to be 3 times as bad. You know? They need that movement. Absolutely need that movement. I agree, and it's very frustrating. So
Yeah. So I think sometimes just putting in the same sanctions that you've been giving to other children and think, no, you're going to stay back. You're going to be there for an hour or so or 2 hours during this detention. And I think, how can you do that to a child with ADHD who
I had a student who I worked with who was suspended, just like you said, excluded. He had a tick in his eye, and they said he was winking at all the girls
oh dear.
and got suspended for 2 days for it. And it's like, no, no, this is not okay. It's not
Yeah.
okay. So we still are fighting some of those arcane, like you said, small behaviors that shouldn't amount to anything that get turned into exclusion and isolation for these
Yeah.
kids.
I think it was on the news once I listened, and there was this teacher who had done really well with students in her class. And she had lots of neurodiverse children in her class, but she'd done exceptionally well. And when she was interviewed, I found it quite fascinating. And she said, well, in my class, I've got lots of them with ADHD, with autism. The children with ADHD, they want to move around. They are moving around. They are learning. They're doing their learning and they are achieving. The children are moving about. It's not bothering her because she knows that this is what they do. They're not being disruptive. The minute you stop them from doing what, their body wants to do, and you then bring in the frustration and you then increase the likelihood of them, erupting. I think we need to take a step back in schools and look at.
Yeah, because I remember being evaluated as a teacher, and the description of my classroom was organized chaos. Because just like you were saying, they're doing what they're supposed to be doing, but they can move around, they can talk, they can, as long as it's within reason. And my principal came in and he's like, it looked like chaos to me, but I started talking to the kids and I realized every single one of them knew what they were supposed to be doing and were doing it. And that's what worked.
Absolutely. Absolutely. I think there is just a lot. And one of the things that you've raised is that the doctors and the schools, the medical professionals need to be working hand in hand with the schools in terms of supporting the children, because what happens, and it happens here as well, is the doctor sees and says, well, this is what the school should do. The doctor is not aware of how much that teacher, whoever is supporting that child, how much they know of that child. And so you don't get any kind of working together feedback with the schools, and everybody's just working in silos. And when you take a step back and look, you feel there is a lot more that you could have done for that child if you were working together. And where it has worked well for me is where sometimes I've had teachers being part of that assessment. Sometimes teachers used to be able to come into the clinic for the assessments with the child. They came in, they were part of that assessment, and they understood on a one-to-one with the doctor, understanding the child's needs and discussing with the doctor the best ways to support the child. We've had a lot of difficulties with capacity and our waiting list, and which I think has affected the way children are assessed and diagnosed as well.
Oh,
So
absolutely. There's not enough of you to go around.
yeah,
There's not in the US either. There are not enough of you to go around.
yeah.
We need more people doing what you're doing and helping these kids in that way.
But that's why we need a wider discourse about, it's a team around supporting people with ADHD.
Absolutely.
It's everybody pulling together with their skills and their abilities to support the child and young person. And it's my hope that as time goes on, schools will be that place that actually help to recognize and support, the process of assessment and managing and the environment at school.
The one thing that, this just popped into my head, but one thing that I really have noticed, and I don't know if you see this going the opposite way, as an administrator in education, if a parent had a document from a doctor that said recommended possible accommodations, they instantly believe that their child is going to get every one of those accommodations, and that it is written in black and white and it is in stone. And it's like, but your doctor's giving some ideas. They're just, they're not saying this is what you have to do. This is
Yeah.
ideas for you in the classroom. We do know the student in the classroom probably better than, the doctor does. And so we would know a little bit more about what accommodations work for them. So do you see that when they come from the school and they come to you and say, the school says,
Yeah, we do. We do. And we have parents complaining a lot about schools, that the school hasn't done this or that, we completely, we've heard that as well. And I think this is what makes it difficult when the schools are working separately from the doctors. Because if you had a joined up way of supporting the child, then you would agree what that child needs. Between you, you would agree and say, little Johnny, has had this. These are his strengths, but we feel that this is what he might need. The doctor and the school will agree and then be able to implement what Johnny needs to be able to succeed. But at the moment, it's very much done in silos, as
it is.
one person is giving a directive to the other person. So I do hope that changes. I do hope that we have opportunities, to actually work together in whatever form it is. Sometimes it might just be a short meeting with the school virtually with the teacher, knowing the teacher for that child. And then the rest of the people in the school as well. So
Been to some big IEP meetings, but I would never say no to the doctor coming.
yeah, good. So what are your final words for parents, doctors, and educators?
Well, my final words, I guess probably to keep in mind that each kiddo has their own individual strengths, their own individual struggles, and making assumptions is one of the worst things that we can do. We need to really pay attention to what's happening with those kids and address their actual needs instead of making an assumption when we hear the ADHD. And I think a lot of times people hear ADHD and this vision of what ADHD looks like pops into their brains, and that's what they hear, that's what they see. And so I would say open-mindedness and willingness to learn about ADHD and how it shows up for kids would be a great way to start.
Fantastic. And teachers as well, and everyone in the same way.
Absolutely. Teachers, parents, like I really, when they say knowledge is power, I totally agree with that as far as educating, but not just educating, but being willing to learn,
Yes.
right? Because we can educate all we want, but until teachers,
Yes.
parents, students, open their minds and their hearts to what
Yeah.
we're talking about, it's not going to do any good. So that would be my last word is open your heart, open your mind, really look at it, and you'll see that there's so much more to it than is assumed.
Fantastic. Wow. And we could go on and on. It's been amazing. So, where can people find you? I know there will be people who would want to reach out to you for some of the things we've talked about and explore things like
Absolutely.
coaching. So we would very much want to have you send us those details so our audience can reach you.
I will send them all to you. But yes, if you
Yeah.
need to find me, I'm at VanStee, ADHDlifecoaching.net. And that's my email too. It's just at Gmail.
Yeah. Thank you. Thank you so much. It's been wonderful, Janine.
Thank you. It has been a great.
Having your wealth of experience that you've had over the years as an educator. We've heard, a lot about how you worked with young people with ADHD in the schools. And for our audience in the UK, we could also see, how things work in the US. And and I think one of the key takeaways for me is how differently we do it across the pond, in the sense that there's a reliance on schools information before you even get the gateway into seeing the doctor. If your school is not saying anything, you either don't get the referral, or if you get the referral gets returned because
That
you.
just amazes me.
Yeah, yeah. That's in a lot of places that's that pathway. So, and I think it's something that we need to think about because some children are now having, not having that door to even get a look in.
Right. Yeah, that gives the schools so much power in a diagnosis that's not a school diagnosis. That's what I'm seeing is like if there were doctors in the school, yeah, but it's a medical condition that has to be diagnosed by a doctor, a person
Yeah.
who's, that's their
From that
job.
experience, yeah.
Right.
I know it's I think part of it was trying to deal with the capacity issues because initially there was quite a flood of they thought parents were going to GP and saying, I think my child's got ADHD. And it's so much dependent on the experience of the teacher, whether that teacher knows the child. Like you said, they might just be starting and they don't know the child well. And of course, they will give a different score. Child can be scored at different times and have different scores. And the child can keep it together. There's so many things, right? From identifying awareness, supporting, management is important. And then we came to coaching and why coaching is important and how we know that part of your functioning includes the skills that we've talked about, which you're working with the person to be able to eventually become their own coach, or helping them to develop those skills and identifying areas they need to work on. And just to say the coaching to everyone, coaching is so important because the pills won't solve those issues. The ADHD medications won't solve those issues. And if these are areas that really you're struggling with, then we do recommend that you have a coach. And so Janine will share her details with us. And for anyone that wants to reach out to her, yes, we strongly encourage that. Thank you so much, Janine. We'll surely have you back again because I really enjoy this conversation.
I love it.
I've learned a lot myself, and there are things I'm looking into our practices and saying, from our discussions, things that we can strengthen, things we can improve. I think this is helpful for us, for us as well as clinicians in terms of striving to be able to walk with through, just
And
your person.
I just want to say I so appreciate the fact that you are looking at this topic and you're bringing it out and you're showing it to the world and saying, hey, you need to look at this, right?
Yeah.
Because it's important. So thank you for that.
Well, thank you so much. Thank you. And thank you for the great work you do. And we'll surely have you back again. As we always say, early intervention leads to better outcome. And early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.